I am grateful every single morning for my first sip of my first cup of coffee. And we have a frequency for that.
Learning to listen to the patient's priorities instead of just ours.
My new reframe is, when this gets resolved, what are the first two things you are going to do?
And when he got to the point where it didn't make sense, he would literally take the chart, walk out of the room, put in a blank piece of chart note paper, walk in, and start over.
Sometimes you just have to look away, leave the room, and then hear it again for fresh ears, new eyes, whatever that is.
I'm thankful to FSM for is making me think.
If this happened to this, could this happen to that? And starting to think about everything being connected to everything, because at the end of the day, the most important thing is helping somebody get out of pain and back to function.
Thank you for subscribing to the Frequency-Specific Microcurrent podcast. FSM is a breakthrough tool for medical practitioners who feel stuck with limited treatment options, especially for complex issues, unresponsive to conventional care. FSM training is the best continuing education course for medical practitioners. Get our free introductory webinar at frequencyspecific.com/about, or find FSM trained practitioners at frequencyspecific.com/find. Here's Dr. Carolyn Kim Pettis.
Well, hello.
Sure. I was in the middle of a meeting that, went longer than meetings are supposed to go to. And then
Well,
sudden I had to get makeup on.
And that's our theme for today is our thankful. It's our thankful podcast. So we're thankful for meetings.
Mostly I'm thankful for the podcast and everybody that shows up, all 27 right now, but by the end of the next 20 minutes, there'll be 30 of you.
I was just going to say, we always hover between 27 and 31 live. And then
35.
Yeah. And then I know a lot of people just listen to us on commutes and drives, or they watch us on YouTube. Yeah. So this is going to be our thankful Thanksgiving episode.
Because it's the day before Thanksgiving and everybody is home.
Yep.
From work or leaving work early and contemplating how long exactly do I have to defrost the turkey?
We are actually having a turkey-less Thanksgiving this year.
Turkey, everything except the turkey?
It's like everything but the turkey meal. And it's funny because I grew up with European parents who did not traditionally have Thanksgiving or turkey. And it was something they begrudgingly made. And same with my husband, also Italian, did not really grow up eating turkey. So this Thanksgiving, we're like, you know what? We don't especially like it. Let's just not do it.
Okay. That's a good idea.
So we're going to have a ham and we're going to do my grandmother's meatballs, which maybe not be Thanksgiving, but meatballs and her gravy on mashed potatoes is a religious experience unto themselves.
And if you're Italian, and my daughter and my grandson both have to work tomorrow, and my sister is in San Diego, and I'm here with me and 3 dogs. So there's the 3 dogs and canned turkey food. But there's this restaurant down the street that has a great buffet that's fully booked. But the head waitress was a friend of Adam's, so I'm one of the people that helped raise her. And so she said, well, you could sit at the bar and just get food. So I'm going to get all the turkey with none of the cooking and none of the dishes and none of the table setting and all the stuff that I did for 30 or 40 years.
That sounds fantastic.
That's pretty good. And then just when you think about it, it's everybody's read or seen the book Messages from Water, right?
I think so.
And so he has this freezer chamber with a microscope in it. And outside the freezer chamber are these little vials with words written on them. I hate you, I love you, And there's one vial that says love and gratitude, and there's one vial that says wisdom. And when he took those vials into the freezer chamber and took a dropper of water and put it on a slide, and it would form a crystal. And roughly 85% of the crystals were identical. And wisdom is 1, 2, 4, 6 hexagonal, shaped with little chevrons in the corner. And I hate you doesn't even form a crystal, it forms this blob.
Right.
And love and gratitude makes this sunburst that he calls the best of all the crystals. So when I built out the clinic, those of you that haven't been to a core at the clinic or practicing at the clinic, and you really ought to, because I was talking to Mary Ellen Chalmers last night about how much it has changed since 2006 when she took it. We had this chunk of wall that was blank. And I told the contractor, I want you to put up a frame and a rail for chalk and erasers, and I want a line down the middle and blackboard paint. And on one side, it said, what do you love? And what are you grateful for? And what shows up on that is everything from the mundane to the complimentary. There was one that was grateful for cinnamon toilet paper, flush toilets, lavender hand soap, FSM, of course, Dr. Sandra. Just, and when you start thinking about the things that you're grateful for, it's really hard to know where to stop, you know?
That's a great way of putting it. I know some people, depending on what season of life they're in, sometimes have a hard time starting. Sometimes some people are just like, I'm not grateful for anything. And like you said, it doesn't have to be anything large or profound. Start small. Like you said, cinnamon. I am grateful every single morning for my first sip of my first cup of coffee. There's something about that first gulp that it's just a little bit magical, especially now that it's cooler. I'm very great. I feel like I start off my day not with this profound gratitude practice, but when you can just slow it down for those small things of, oh, that just tastes so good.
And it's what gives you pleasure is also something that you're grateful for. So I'm grateful for an espresso machine in my kitchen
Yeah.
that I've had for God knows how many years. And so that first cup of coffee takes a number of shots before it's a mug. But yeah, and steamed milk. And then there's a place called this is not an advertisement, but it's called the Spice and Tea Exchange. And they have flavored sugars. Now, this is all Kathleen Kassman's fault. If you're listening, Kathleen, you know exactly what I'm talking about. A Spice and Tea Exchange, and they have bourbon black walnut sugar.
Ooh.
And it's a little bit wet. It's not granular because of what they have to do to it to make it bourbon, taste like bourbon and black walnut. So it's like a cup of coffee, 1 teaspoon of bourbon black walnut, and I look at my monitor and it's okay, I get away with that. It stays under where it's supposed to. And so I'm grateful for bourbon black walnut sugar.
I am too, and I haven't even tried it. So I'm grateful for
New things to be grateful for.
Yeah, there definitely is. And so I hope that everybody listening and watching, whether you watch it on Thanksgiving or you end up watching this sometime in July, I think a small gratitude practice is always helpful, even like for those super small things. You and I were talking the other day on the phone and I was laughing so hard. I don't know how we started talking about this, but I do. We're talking about Roger and we're talking about certain things. And it brought me back to when we had the advanced, and I'm not sure how many years you had it in Vegas, but there was one trip that we were there and you had texted me and like the message or the email was like, like alert or urgent or something. And I opened it right away and it was like, there are no coffee makers in the hotel rooms. You must
Oh,
bring
that's
your own.
right.
And it was a link to this tiny coffee maker on Amazon that I had just gotten the day before I left to come there. And somebody, and you had talked about it, I think, at the conference. And people were like, there's coffee in the lobby. And you said very quickly and seriously, but I need coffee to get to the coffee.
And they frown on people coming down on their pajamas and
that would have been my hair on fire in hysterics. Where's the caffeine? So when I think about big gratitude moments, I'm very grateful for the emergency alert email telling me to bring my own coffee maker to the Advanced in Vegas.
yeah, you got to know what you want to know.
But it was just so funny. I need coffee to get to the coffee. And that
Yeah.
was a true story for me as well. Grateful for warm coffee.
Speaking of grateful, I'm grateful for Roger Billica, who is no longer with us. And that was sudden. Like, what?
Yeah.
Roger was supposed to outlive me.
And me, I'm sure. Roger was, and we talk about him quite often for some very simplistic yet very profound concepts that he put in our heads. And so when I think about Roger's legacy, I think about taking something very complicated and being able to explain it in digestible bits. You think about some of his talks with neurotransmitters, and I remember one of my favorite ones, and I'm not sure if this one is on video, of we would all go into different corners of the room. And it was such a fun and interactive talk. I've never learned neurotransmitters as well as just being
So
his lectures.
because we did the Braverman, and
Right.
you take the Braverman
Yeah.
and you take your top score, and
Yeah.
then whatever your top score was, you go into that corner. And then your top two scores, then they went into a different part.
Yeah.
And then the top three scores. And and it just explained behavior.
Yeah.
This person is not inherently annoying and getting on my nerves. They're a GABA person, and my GABA score was like 12 at that point, and everything else was 30.
Yeah.
So I'm definitely not a GABA guy.
Yeah.
And then when you see patients, you can actually tell
Yeah.
pretty much what, if you've read through the Braverman and if you have looked at Rogers' molecules of behavior
Right.
presentation, I look at that at least 3 times a year.
Mm-hmm.
And once you get used to it, you can pretty much tell what somebody's neurotransmitter profile is by what they do, what they did, what they did in school,
Mm-hmm.
and how they present their history to you. I love engineers, librarians, accountants,
Yep.
because they present a linear timeline
Yep.
in order. Dopamine and serotonin people don't do the timeline. So I did this and then I did that, and it's like, wait, what years? I don't remember actually. Okay, definitely not GABA. And then it's
Yeah.
just, and speaking of being grateful for Roger Billica, is that up on the website yet, Kevin? I, I,
No.
I don't.
Yes.
Our tribute to him is up on the website on how do they find it? He's sending out
It's on the website, but I haven't put a link to it like on the homepage or anything like that.
okay, so there's going to be a link to it soon, but because we've always charged for the molecules of behavior, because it just didn't seem right to give it away for free because it's so important. So for probably till January 1st, it will be free. Download it, read it,
Yep.
read it again,
Yep.
memorize it, read it again.
It's a
And
phenomenal resource that
and the fibromyalgia workshop, which is an all-day event, and he did the infection causes of fibromyalgia. And so the fibromyalgia workshop, which is also worth way more than we charge for it, that's going to be free until January 1st. So if you haven't watched those, now is your time. And thank you, Roger Billica. I would have loved to be a fly on the wall for his life review.
and just, and as we're doing it, so this will be for the YouTubers. I'll try to verbally explain it for the people who just listen to it. So this was one of Roger's contributions. He had this slide and it was a target, a bullseye with waft. And we were all looking at it like, what the heck? And waft stood for, we have a frequency for that. So again, he would start these super complex lectures that you would be terrified even looking at the title, and especially if you knew who was presenting it. Roger, with his professional acumen of what he's done and who he's worked for, you're like, hey, am I even smart enough to be in this room to listen to it? And then he would start with waft. And I think even one year he had a t-shirt that said it too.
We did.
So like I said, and with you again, I'm giving away his resources. Such a gift. He was such a gift to us, and take advantage of the fact that you can get these resources, because he did change my practice between waft, always thinking there is a frequency for that, always being able to search for an answer. And then something that we talk about at least once a month is sometimes you have to put in the good before you take out the bad.
Yeah.
And when we talk about the differences between what microcurrent is versus a TENS device, when I'm talking to especially athletic trainers and people who are used to STEM and they think, what's the difference? And we talk about ATP and something that drains energy versus something that bolsters it. I think of Roger all the time. And I said, doesn't it make sense? Sometimes you have to just put in the good. And they're like, oh yeah, I want a machine that does that. Yeah. And we have a frequency for that. So
frequency for that.
I'm just so grateful for those. Like I said, super, maybe it seems simplistic, but I think we overcomplicate so many things so often.
And actually things are so complicated and interwoven,
right,
that the trick is they are already overcomplicated.
right.
And to be able to understand them well enough that you can take what is actually really complicated and create a framework that makes it at least not scary, at least not simple, but you got all the pieces, but not all the pieces. And you can make it understandable and not scary. And
right. And that's a good point. And I don't mean to like oversimplify some extremely complex cases. And you have to be mindful and make educated hypotheses and not just look very myopically, because I think that's the other side of the equation is we have a lot of practitioners that just see, I'll use frozen shoulder for an example. Frozen shoulder is something that happens exclusively in the glenohumeral joint, and they bypass the thoracic spine, the scapulothoracic articulation, the neck, the ribs, vagus, all the things. But, and then to be thankful for Kevin's quote of, how do you eat an elephant? One bite at a time.
yeah.
And that's the way we get to look at things also with FSM. What do we know to be true in this moment? What is presenting? What's the history?
I have a patient right now that has my cell phone number. So she texts me and she said, well, I have thoracic outlet and they want to do surgery. And I went, oh, no, don't, because they just, okay, I'm glad you're sitting down. They want to do a pec minor release.
Oh, for goodness sake.
Thank you. Your self-control was admirable.
What?
Yeah. And I said, no, because that destabilizes the whole shoulder and then The next problem you have will be your shoulder and the thrust. And then the pec minor is no, just we find enough. It's easy. The pec minor is easy.
Yeah.
And you don't even expect lightning to strike anymore.
No, not for that one. I wouldn't even know what a pec minor really. The pec minor is skinny and small, but creates, like you said, so much stability with its attachment. Very easy to release, especially with FSM and manual therapy.
And the release is you cut the attachment to the coracoid.
But
Hello?
how would that help anything?
It takes the pressure off of the nerve, artery, and vein that are part of thoracic outlet.
I understand, but that would maybe help temporarily, but wouldn't it just create more inflammation, scarring, and inflammation down
Yes,
the road?
but if you're a surgeon and you got to do something, at least they didn't want to disconnect her scalenes from the first rib. I'm thankful for that. It's just okay.
As we're finding things to be thankful for.
Yes, that's the other thing, that being thankful. I read a book called, what's it called? Living with Joy. And
Mm,
it was in part, it was about reframing. So just saying thank you for anything that happened, no matter what it looked like. So you're stuck in traffic or you're in traffic and the light turns yellow and you put your brakes on and you would really be tempted to be annoyed that
right.
you didn't get through the light and whatever. And reframing it is, on the other hand, because I had to stop at this stoplight, I might miss the car down the road that would have run in front of me and got me into an accident.
Sure.
So it's being thankful for something like a red light that seems to be negative
Yeah.
or inconvenient.
Yeah.
And there's that. And the other thing about reframing for patients is the patient comes in with a series of complaints, which as a picture you can fix because this is connected to that, is connected to that, and you just do this and this. And to the patient, that set of symptoms is their whole world. And I said, here's the thing, nothing you have scares me. And they go, okay. And what I see in front of me is somebody that can see, you can swallow, you can chew, you can eat, you can pee, you can poop, you have joint pain here and there, and you have body pain. That's inconvenient. What you have is uncomfortable. I'll give you that. You don't like it. I don't blame you. I don't like it either. Pretty sure I can help. But I want you to think about it as inconvenient. It's
Mm,
a management problem.
right.
And when you think about the things that, like you and I sitting here talking to each other, we have computers, we have houses that have heating. I have a Kevin, you have a you that's able to do Kevin. And it's when you think about how lucky we are, all the marathons and the half marathon ribbons that are behind you, and all the family pictures and the event awards from different advanced and symposiums that are behind me. It's like there's and the books on the shelf that filled your brain. But
Right.
where do you stop being thankful is the thing.
Absolutely. The one reframe I think about, I mean, there's so many things I'm grateful for you about, but was the complex patients that would come in that would stump me and irritate me because I wouldn't know how to fix them right away. Was, what is this patient here to teach you? That reframe right away, instead of feeling like defeated and wishing, why don't I know this? As a perfectionist, that's what will bother me. I should know this. Why don't I know this? Why can't I help them? The reframe, what is this here to teach me? Oh, okay, so I get to learn more about this and I get to investigate more about that. And I can ask questions to you and Dr. Burke and Dr. Catholi and whomever, Dr. Sosnowski, the people that I get to have on my phone to text, and to not feel stupid, but to look at it as an opportunity to learn even more.
And the other important thing I think that FSM practitioners do is ask the patient what is the most important thing for you.
Sure.
It's like, I just fix it so my foot stops burning.
Yeah.
Oh, well, that's just nerve pain. Okay, I can do that.
Yeah.
Once we fix your foot, then what's important? What's the second thing on your list?
Yes.
And it's like that, learning to listen to the patient's priorities instead of just ours.
My new reframe is, when this gets resolved, what are the first two things you are going to do? And
Yes.
you can see, to your point, talking about joy, the smile on their face, just thinking about, and maybe it's something really small, as I can't wait to hold my grandson, or I can't wait to put on my shoes by myself. And they're typically not these huge, profound activities. They're small pieces that bring them joy. So I think that's an important component as well. And it's also not becoming attached to what you want to see them do. It's like you said, what is important to them. And that helps you figure out where you need to start planning.
That's actually where the ulnar nerve transposition paper.
Yes.
Okay,
That
so
was Dr. Jody Adams did that
yeah,
one. Yeah.
Jody Adams.
Yeah.
The patient, when he was 19, for reasons that still escape me, they moved his ulnar nerve from the track where it's nice and protected by the bone. They move it out onto the arm. And a year later, his pain was worse. And so he went to 12 sessions of PT, and his pain score went from a 7 to a 5. And his functional score went from 82 to 86. So it was, by our standards, it wasn't great.
Yeah.
And his treatment goal was to be able to hold his baby. His wife was pregnant. And he couldn't bend his arm without excruciating pain. And that was his treatment goal, was to be able to hold his baby. So we treat it, it's just nerve pain and scar tissue, so it's not that hard.
Yeah.
And then a year later, Jody had already delivered her baby. And then we checked with him and got a 1-year follow-up, and that made it a better paper. But that's what was important to him. It wasn't, I want to be able to bend my elbow, I want this, I want to be able to hold my baby. Just like, oh.
Yeah. Yeah. And keeping that in their mind and keeping that as their goal, I think, is important. Like you said, it's not about measuring flexion or extension, or you can do that in your clinic, but when you're having those conversations, that's what you need to keep in your mind. So we have a big long question that looks like,
Yes. And it's Suzanne. Hi, Suzanne. Happy Thanksgiving. We're thankful for you too. I don't know about you guys, but one of the things I'm most thankful for are the people that study FSM, and for the 30% of you where it takes over your practice, where it changes your life, where you get it, where you put your hands on people, where you figure it out, where it makes you think, where you do that. And that's not going to be everybody. It's going to be you. And so I'm thankful for you. 57-year-old with 2 disc herniations. Okay, wait. Okay, okay, so here's the language. These are disc bulges. Nobody has a herniation with a fragment for 30 years. Somebody is going to operate on it because he won't be able to walk. There's that. And then 6, which is S1, is a year old. Successfully treated him 2 months ago and was slow to return to pain. Yay. Epidural for pain. Oh, great. Very restricted with severe back pain. Duh. Previous treatment was visceral manipulation, ureter, bladder, liver. Yeah, but you have to Okay, so the pain is back. No, the pain is back because the repair tissue on the disc annulus is fragile. And all he has to do is I was going to say something stupid, but something biomechanically difficult for the L5S1 disc. And so you're treating him for a chronic disc. And what he has is an acute, what I call a subacute or an acute on chronic disc. So you need 60 minutes on 124 and 710.
Yes.
And
So
then,
let me just interrupt with
oh yeah, translate.
translations.
Thank you.
124 is our frequency we use for repair and heal, or AKA torn and broken. Yeah, these discs aren't like herniated, they're irritated, or they're, what's a better term for these discs besides, I don't want to minimize it by saying irritated, but when we use torn and broken, that helps the wear and tear on the annulus and all the splinting that happens with the associated muscles in the back and in the core. They splint or tighten up to protect the area that's irritated around the disc. So all those frequencies that this person has listed, like scarring and inflammation, we can't really expect them to help, because we have to think, where did this come from? It comes from a worn and torn disc. And so 124 or torn and broken or repair and heal would have been the better go-to, correct?
And she said he's done a lot of home treatment with 124 and disc parts, but someplace in here it says 783 seem to be the most successful. And unfortunately, the patient is entitled to more than one complaint. So the question to ask is, he had the epidural because he was restricted with back pain. Epidurals are for nerve pain, which makes you wonder why they did an epidural for back pain. That's another conversation. Previous visceral manipulation, and I'm assuming, yeah, ureter and the psoas, the bladder, the liver, inflammation. Okay, so you didn't do, because what can happen sometimes is you run scarring in the ureter on the psoas, loosen the psoas. So now all of a sudden he can extend his hip and jam the L5S1 facet. And so the good news is his back is an extension, so the disc isn't as much of a problem, but you do jam the heck out of the periosteum and the facets. So subacute facets, and I guess clinical examination indicated facets. The facet protocol, believe it or not, I forgot to put in the cartilage when I go back over the old mode bank, and I don't think they've pushed out the new one yet. Go back through subacute facets and make sure that 40 and 157 is in there.
Yeah.
And
Also 124, 157.
yeah.
Yeah.
And so she tried cartilage. Sounds like you've tried a lot. My suggestion is to try less.
Yeah. One thing that jumps out at me, and you can correct me if I'm wrong, but when I hear and see things like when scarring, so she was said running almost anything, 13, 51, 20, 30, 40, 50, blah, 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 blah. If scarring increases pain, that's when I start thinking about something is still indicated for torn and broken. So it could also be torn and broken in the ligament. There could be some hypermobility. So when we start releasing inflammation and scar tissue and something that's hypermobile, then something moves, translates. I think about the shoulder. Anytime I've increased pain in the shoulder is when I've undone scar tissue that was splinting because of ligature laxity. And then there was something with the joint surface that perhaps was still involved, like old Bankart lesions, old Hill-Sachs lesions. So when I think of something where scarring and fibrosis increases pain, I think we need one more of 124.
And the other thing is, what if facets don't do it and discs don't do it in low back pain, butt pain?
Yeah.
that the only thing left is an SI joint.
Sure, exactly. And then that's why I think her running 783 seemed to be successful, because that SI joint, 783 is a wonderful frequency for that area.
So I think that we go back to what happened. What
Right.
happened between the epidural and the next time he saw you? Did he fall on his butt? Did he sit down hard on a chair because something was numb? And did
And
he?
re-injured the area.
So I had an orthopedic surgeon who, God bless him, he was a shoulder surgeon, and he'd work on somebody and see them and inject this and do that. And when he got to the point where it didn't make sense,
Hmm.
he would literally take the chart, walk out of the room, put in a blank piece of chart note paper, walk in, and start over.
Yeah.
Tell me what happened.
Yes.
Well, I told you what happened. Yeah, but tell me again, between this time and that time, what did you do?
Oh, thank you, because I think that is, I was thinking about this concept the other day. My oldest daughter and I have a love affair, is putting it mildly, with jigsaw puzzles. Whenever she's home from college, I get an extra table, I set up, and we put a crazy jigsaw puzzle on the table. And it's like when you're trying to find something, and sometimes you just need to walk away from the puzzle, get a cup of coffee, and come back, and then you're like, oh, boop, 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 boop. And then all of a sudden you can see things differently. So thank you for that. Sometimes you just have to look away, leave the room, and then hear it again for fresh ears, new eyes, whatever that is. And then thank you, Lee, for saying 124 is time dependent. So I'm hopefully she's
So
running.
it's 49.
Yeah. So I think those are important concepts. Hopefully running repair and heal, or torn and broken, however you want to frame it, for a while, and try it for sure on 7. If you're thinking SI joint, then I would for sure go 124, 783, 157. And
124 and 77, because I know it's ligaments.
no, but yes,
It's bone to bone, but they're
yes.
the densest connective tissue in the body.
Absolutely. And I think I threw this pro tip out before. If you're opening up netters and all the muscles and the tendons, but when you see those fibrous kind of white areas, that's that dense connective tissue. And the SI joint is so rich in that area.
Front and back.
The other thing I'm toying with, and I have another practitioner that I was talking to this about. So we use 214 for meniscus and labrum. I am also curious if it works for the pubic symphysis.
Oh, wouldn't that be great?
Playing around with the concept right now,
Okay.
and it seems to be working.
Because
But
I would have thought 710 or
yes,
like a disc annulus or cartilage.
yeah, but I think 214
Labrum
seems to be
might work.
maybe, if you think about the material of a labrum and a meniscus, 214 in the pubic symphysis might be the same. I don't know.
It's, if you think of the labrum and the meniscus, hip, shoulder, meniscus, and the knee,
Yeah,
it's halfway between cartilage and connective tissue.
totally.
It's not cartilage, it's not connective tissue, but it's in between.
Yes.
So the pubic symphysis is kind of like that.
Yes.
And I guess that's the other thing I'm thankful to FSM for, is making me think.
Yes.
It's
Yes.
not like just waving a laser at something, and no offense to lasers, but because they do good things, but it's not like waving a laser at, this is what I do. Bye. See you next time.
Yeah, I so grateful for thinking of tissue types and pathology in different ways, and following, as you say, following the breadcrumbs or following the spark. If this happened to this, could this happen to that? And starting to think about everything being connected to everything. And Susanna just wrote, she has not tried 100 yet. So I think about
77.
77, yeah, like connective
77.
tissue and ligament. If scarring increases pain somewhere, that's the first thing I think of. There could be laxity somewhere, or something is destabilized.
If it's facets and discs don't work, the only thing left is the SI joint.
Correct. Yeah.
It's like,
And
love being us.
you know what I'm very thankful for this week? I know it's only Wednesday, but the low back pain protocol in the mode bank is pretty fantastic.
Thank you.
Like, just as something to slap on if you're not totally sure, it really encompasses kind of everything that you could.
Like, throw it up against the wall and see what works. While I'm busy working on your shoulder, let's treat your low back.
Were you in the room? That was exactly what happened yesterday. There was multiple areas, and it was like, okay, custom care with low back pain. I need to just start with this, and it works. And like I said, and sometimes you just need to just put it all in the soup and just see what helps, because at the end of the day, the most important thing is helping somebody get out of pain and back to function. And maybe you can't figure it out. Maybe it's not waft right away. Maybe it's just
Dude, you have to figure out which FT it is. This is just a success story for the week. That was a surprise. So I got a referral from an MD in Lincoln City, which is about 3 hours away. So the patient comes in, she's 76. She's diabetic, on insulin, not on a pump, not on a CGM. Her hemoglobin A1C is 7.1. So her blood sugar is not controlled. And she has had post-TBE neuralgia for 3 years. Between, it looks like about T11 and L1. So it's all along her side, and she's about 60, 70 pounds overweight, all along her side and down into her groin. So that's L1. And I said, you got a bunch of things going against you. You're 76, you're diabetic, don't have the best diet in the world, and it's been a while, and so I'll do my best, but I'm not overly hopeful. So I set her up back to front and ran the shingles frequencies for a few minutes, and then just ran 40, reduce inflammation of the nerve, and on a second unit ran increased secretions in the nerve, and got her pain from an 8 on Lyrica to 1. Now, because she's heavy, when she's sitting up, she says her pain's a 7 or an 8.
Okay.
When she lays on her back, she says, oh, it's a 0 or a 1. And it's, wait, what? Yeah, it's, if I lay on my back, I don't have any pain. And it's because the nerves are scarred, right, from the virus.
Yeah.
And because she has such a pendulous abdomen, it stretches those nerves. So laying on her back, we did the sensory pinwheel and we got it so that the sensation was all normal. And then we started working on the scar tissue the second day. And I got clear back to the spine, and all that's left when she left yesterday was L1. I just couldn't get my hand down there.
Yeah.
Just stretching it using scarring in the nerves, scarring in the fascia, sclerosis in the adipose, and gently moving it. It's like it, and to be able to, number one, give somebody hope, and number two, give them pain relief. I love my job.
I know, but that's such an important concept when positionally things change dramatically, right? So lying down when things are slack and they have space versus sitting up when things could be compressed or pulled. And you do such a good job of reminding us, like, our nervous system will never let us tear a nerve, right? So all the things that happen when there's scarring and then subsequent splinting. So you not only have just positionally what's happening with the nerve being scarred and pulled in certain areas, but then the muscles And maybe the fascia, from what we're learning, have the ability to, what's the word I'm looking for? This create more tension. I don't want to say contract because fascia doesn't have actin and myosin, but it just changed. It just changed, tighten or something. And we know thixotropic changes happen.
Thixotropic changes, it gets stiffer.
So thixotropic means it gets smushier. So that's why running FSM can be so beneficial, I think, for fascia, because it gives it that thixotropic change where that tight, hard beef jerky web has more pliability to it. And that's what we need for safe movement to occur.
And for the fashionistas in the group, including John Sharkey, we have this conversation every time he comes. Fascia is innervated. And to get the fascia to do that smushy thing, you have to treat the nerve.
Have to treat the nerve. And it's not just for inflammation. So I know a lot of people just think 4396 inflammation in the nerve, but that's a part of it. And that's a good starting point. But scarring in the nerve and then increasing secretions in the nerve. Don't be afraid of that part either. And running both on two machines, like I said, in my mind, I see like dueling pianos, both taking a different approach to getting that nerve to free up and to conduct properly.
It has to be, in order to conduct, you have to reduce inflammation in the nerve.
Yeah.
But then you give the nerve 3 or 4 or 5 minutes on reducing inflammation in the nerve, and then you remind the nerve it's time to go back to work.
Right.
Your job is to secrete neurotransmitters from where you start to where you end.
Right.
And so do that. 81 and 396.
Yes. One of the comments, I think I just minimized it, was, could you remind us what's going to be available for a limited time? And that was Roger Billica's free molecules of behavior, the fibromyalgia. Was it just the two? I think
that's everything else is free anyway, because it's just part of his advanced lectures.
Right. But those two will be available for until
the
year. There's 5 or 6 videos available.
Yeah, there's 5 or 6 videos, but the only ones we've ever charged for are molecules of behavior and the full day fibromyalgia workshop, because the fibromyalgia workshop is more than anybody anywhere thinks about or knows about fibromyalgia. It's like after you've seen, I stopped counting when I got to 480 fibromyalgia patients between 1998 and, I don't know, a month ago.
wow.
I just stopped counting about 6 years ago.
Wow.
Yeah, and it's the first concept is there's different causes. They all end up looking the same. I think we covered that in the core now.
Yeah.
They all end up looking the same. It's an abbreviated version of the full one that Roger and I do. His expertise is in the infectious portion, mold, Lyme. I don't know if he covered cavitations in the jaw, anything that turns the vagus down, infection, stress, and trauma. I cover the stress and trauma, and he covers the infection part. And he and Neil Nathan were
brothers from another mother.
Yeah, exactly. It was that night in Las Vegas when they showed the movie Lyme.
Yeah.
You have a class, what were there like? That was back when the advance was only like 80 people.
Yeah, but it seemed like we were all down there in our pajamas. And
everybody was down there. We had popcorn and people were in their jammies and sitting on the floor. And
yeah, it was.
They kept us there till 10 o'clock that night. We watched the movie, we talked, we asked questions.
Yeah.
The two of them bantered off of each other.
Yeah. And that was when I knew I was part of something extremely profound and special. Because when on earth would you have doctors of their caliber willing to give even more time because they genuinely loved what they do and did, and they genuinely wanted us to learn. And that is something I will never forget that night.
Yeah. It's memories with Roger. That's just
right. Yeah. Just Yeah, so special. When you're talking about like the vagus and things like fibromyalgia, when I had the frozen shoulder, yes, that's the alarm, 4 o'clock.
No, it isn't.
It is. We started late, so we get to go over just a few more minutes.
Okay. Yay.
The the thought process was when obviously your work with fibromyalgia and listening to Roger's talk, that's what got me to think about frozen shoulder having another driver behind it. And my frozen shoulder talk from a couple years ago, it was because of those two talks that I followed the breadcrumbs into, okay, we do have a type 1 and a type 2 frozen shoulder. And there is the mechanical onset of there was an injury and things tighten up, but then there's also this other component of idiopathic, and I have bunny ear quotes, idiopathic frozen shoulder that comes from middle-aged women who are suddenly empty nesters. What's happening with that? Could it be hormonal? Could it be viral? Could it be all these other causes? And so the reason why frozen shoulder is so hard to treat sometimes is because who on earth was thinking about those influences? So thank you to you guys for all of that.
Wow.
Yeah.
I guess I'm also thankful for fall because I'm looking out the window and there's this big maple tree with yellow and green and orange leaves on it, and they're all over the deck roof and they're all over the lawn, and it's not my job to clean them up.
Yeah. It's just your job to appreciate them, which you are. And we are appreciative of everybody that shows up here on Wednesdays to listen to us live and watches us later. And this is, again, your gentle reminder to jump in on the savings to register for the advance before the year is up, before prices go up. FSM Sports has a crazy sale, and for Black Friday, if you're thinking about the sports course, do it now because we cap a small class. So we have time to jump off of tables and do somersaults and things.
That'll be fun. I could just come and watch.
You can just come and watch and stand on things.
Blast.
So
No, and we're doing a 4-day advanced. So normally I have all the frequencies and I do we start with how to think about early onset cognitive decline and dementia and the channel A frequencies we have for different parts of the brain. And I cover how do you think about it? Look it up, see what papers there are that talk about what studies go with what, and then do we have a frequency in the advanced list that you could add to that? Now, somebody, God bless her, I can see her face and me and names. So in the third row back on the right-hand side, as I look down, as somebody raised her hand and said, will you do this? Will you do 4 days next year? Because there's no symposium.
Yeah.
And I want it all.
Yeah.
Okay, I'm not giving out recipes. There are no recipes. You have to promise me not to put this on a custom care, but you have to promise me that you'll think about it because every patient is going to be different.
Yeah.
And so I have 5 days out of the clinic in the first week in January to rewrite the advanced, and I rewrite it.
Yeah.
And that's you got to be there for this one, folks, because
Yes.
this is 25. I may be able to do it again in 27. And then I'll be 82, 81 or something. And so we'll see how that goes. And then come to the advance. It's like a big family reunion. They don't serve turkey because we're in Arizona and turkeys are safe, but shredded beef is not.
The food and the conversation is worth the in-person trip. Absolutely. Yeah.
So I love it. Oh, okay. Now we used up the 4 minutes. We were late. Now we're on time again.
There we go. And I'm thankful for Mick making time for that.
Yay.
All right, everybody. Have a great Thanksgiving.
You too.
Think of all the things you're grateful for, all the frequencies you're grateful for. And
the other thing we did at Thanksgiving was I got 11 by 17 or poster board paper, and felt pens, and everybody that was at the dinner table, all my kids and my grandkids and everybody had to write down what they were thankful for and then pinned them on the wall before I served dinner.
Oh, I love that.
That was a fun 5 or 6 years.
Because there's something very profound about putting pen to paper with a thought. So let's steal that one. All right, everybody. Thanks for coming. And we'll see everybody here, same time, same place next week.
Bye.
Bye.
The Frequency Specific Microcurrent podcast has been produced by Frequency Specific Seminars for entertainment, educational, and information purposes only. The information and opinion provided in the podcast are not medical advice, do not create any type of doctor-patient relationship, and unless expressly stated, do not reflect the opinions of its affiliates, subsidiaries, or sponsors, or the hosts, or any of the podcast guests or affiliated professional organizations. No person should act or refrain from acting on the basis of the content provided in any podcast without first seeking appropriate medical advice and counseling. No information provided in any podcast should be used as a substitute for personalized medical advice and counseling. FSS expressly disclaims any and all liability relating to any actions taken or not taken based on or any contents of this podcast.